Hello, I'm Marion Nicholson, the director of the Herpes Viruses Association. It was formed in 1985 when the press was full of all sorts of headlines about herpes simplex, such as the love bug and the curse of the promiscuous and new sexual plague. Since 1985, we've been helping people with herpes simplex. We base all our information on the BASH guidelines, so that's the guidelines from the British Association for Sexual Health and HIV, and that ensures that we get exactly the right information, up-to-date medical data to share with the patients. We support medical professionals, of course, by taking over the onerous task of explaining herpes simplex to people who've been newly diagnosed, because it's a highly emotive condition as well as being a physical one. And patients often need a lot of time with someone who can both understand what they're going through as well as being able to give them the facts. There are 5 things I would like to share with you today. Dermatologists can help patients enormously with how they speak about it when they first meet patients with herpes simplex. The internet is awash with all sorts of scare stories about herpes that can really frighten patients and exaggerate their fears. So the first thing you can do when you have a patient with herpes simplex is ask them what about it is worrying them. You'll be quite surprised. You need to be prepared for all sorts of exaggerated fears that they might have because of what they have Googled. So you've got to de-Google them. A common worry, for instance, is that it is incurable. For the patient, that could mean that they feel that they've got something that will kill them. So you need to answer by explaining that herpes simplex is cured by the body itself. Drugs are helpful, not essential. And mention that it is like chickenpox in that respect. Chickenpox, you can tell them, is another herpes virus, and as is glandular fever. People have heard of those, they don't worry about those, so that's a way of getting rid of any fears they might have about this fact.
The second thing to remember is just how utterly common this is. Over half of people have this virus by adulthood. In fact, if you've had more than 7 partners, or if you're over 30 and you don't have this virus, then you're in a minority. But of all people that do have this virus, only 1 in 3 ever notices, and not all those get diagnosed. 2 out of 3 people with this virus either don't have symptoms or have symptoms that are so mild they think it's something else. Mild thrush, an ingrowing hair, a washing powder allergy, for example. For those who get their outbreaks on their hands or their face, they tend not to think of it as herpes, and they don't think about it at all when they don't have any symptoms. And for those who get it genitally, they're just not talking about it.
People are worried about what they think they know, not the reality. Abstract fear is more unsettling than reassuring facts. When antiviral medication was first developed, the downside of herpes was exaggerated to create a market. This is a process we now call disease mongering, and it was first described by an Australian journalist back in 2002 in an article in the BMJ. This has since become widely recognised across all medical areas. Our advice can change lives and enable patients to continue with the normal life they never thought was ahead of them.
Thirdly, an important fact to remember and share if necessary with patients is the fact that herpes simplex, although the average incubation period is 2 days to 2 weeks, with 4 or 5 days being the most common, could actually turn up years after the person actually caught it. The longest we know of is a lady who phoned up and said she hadn't had sex in 15 years and now she had symptoms. This is a very useful fact that you can share with patients if they need to, for instance, mention to a regular partner that they now have herpes simplex without indicating that they have been unfaithful. I call it the cheater's charter. It's useful for a patient to be able to share with their regular partner that they've got this so that they can avoid sex at appropriate times. There is no need for them to explain that they caught it by being unfaithful. They can be told quite factually that a person could have had it long time before it's first noticed. So there is no need for them to mention the infidelity. Fourth item, anything they've read about it that's frightening or even just a bit worrying is wrong. For instance, people read that it will turn into HIV. No, it doesn't. It just says that people with herpes simplex are more likely to contract HIV, but you have to be sleeping with somebody who has got a viral load of HIV to do that. It will not turn into it. And then another fear for women is that they would have to have a caesarean section, and whilst that is an option if they wish, if they're worried, the guidelines from the Royal College of Obstetrics and Gynecology says very clearly that a woman is allowed to have a normal delivery even if she has a recurrence at the time of birth. The situation is different with a primary infection, but for a recurrence, normal delivery is preferable to a caesarean. The health outcomes are better. Lastly, of course, yes, they'll have a normal sex life if they're looking for one. So the internet, which tells them that their sex life is over, you have no idea what there is on the forums until you go and look, is incorrect. Yes, you can have a normal sex life. 83% success rate when our HVA members decided to share this with partners. They were not dumped. So lastly, the fifth thing you can share with patients are the details about the Herpes Viruses Association so that they can talk to us, so they can get answers to their questions. We're easily findable on the internet, or pick up one of our leaflets. Thank you.